Clinics. Dr. Megan Peterson joins us in studio. She's a I knew I was going to mess this up, gynecologic
oncologist.
Thank you so much. I always stumble over that one. Well, thank you for being here with us. We have you here because September is Ovarian Cancer Awareness Month, and we wanted to learn a little bit about that. And first of all, the department at Billings Clinic and what you guys do.
Sure. So ovarian cancer is one of the most deadliest type of women cancers, but it's not as the most common. And what we try to do is treat all of the whole patient at Billings Clinic. And so we treat them from their diagnosis all the way until their end of their treatment at 5 years.
All right. And so what are some of the early warning signs of ovarian cancer?
Some of the early warning signs are bloating, feeling full very fast, nausea, vomiting, and just this vague sense of not feeling correct.
And let's talk now about the screening. If a woman is concerned, how do they figure out if they have this or not?
Unfortunately, we don't have a screening test for ovarian cancer. There was some blood testing and ultrasounds that we were looking at to use as a screening test, but for asymptomatic women, it's not very helpful because it can lead to a lot of false positives and then other problems with if we do a procedure on them. So we use the screening test for people who are at higher risk, who have like a genetic change in their DNA.
All right. And how do we go about figuring out the cause for this and prevention as well, if we want to stay away from it?
Right. Unfortunately, there's not a lot of prevention. So cancer is on a global sense, is a problem with the DNA. And with ovarian cancer, there's so many problems with the DNA that we haven't pinpointed down to one particular thing. We have found that some carry a higher risk, and so those people can have prevention, like have preventative surgery. But with the most general people, it's just a random change in the DNA that causes it.
All right. Well, Dr. Peterson, thank you so much for being here with us this morning. We really do appreciate it. We'll be right back after this break.